we started from the outset. One of our reasons for going independent was to go with an electronic medical record and a paperless office. That was our goal, and looked around for all of the options. We had followed e-MDs for a very long time, like very, very long time, and so did more research, and it really was, for what we were trying to do, certainly in primary care, the best end-to-end solution that we had, incorporating practice management and EMR all in one, as well as a scanning solution. That's a critical piece to being paperless. So we've been on the product now for almost 2 years, and been very stable. For us, one of the biggest things is the integration, the incorporation of the practice management side, which really is a whole separate beast in medicine, with the electronic health record and the paperless practice, and then all of the benefits that go with that through e-prescribing and problemless management and chart management. They are separate things, and in many practices they truly are separate products altogether. But by integrating the two at the core level, you get efficiencies that are fairly dramatic, and that's really, to me, probably the biggest strength that it has. I'd say e-prescribing is one of the most important things that, and in terms of evolution through time, is going to be critical. It will be a requirement, and as I understand the current legislation for dealing with Medicare, you have 5 years, and it's a safety issue. The Institute of Medicine report in 2001 outlined several issues, and electronic prescribing, where we're maintaining a medicine list accurately, checking it for allergies, interactions, known problems that people have had with medications. That's a really, really critical element, and the patients appreciate that. And with the software, that's one of the most common questions that we get. We do a lot of chronic care. That, doctor, how do I know that these medications aren't interacting with each other? And I just turn the monitor around and show them that, sort of red light, green light, yellow light, that it's doing this in the background. And it's fairly intuitive, certainly glancing at it, easy for the patient to see, my doc's looking at this. And I think that's very important for quality. Record availability is probably the other hugely important issue, that a patient comes to the office, that I have their record. I don't have to call for it. I don't have to ask where it is or who has it, whose desk is it sitting on waiting for something to be done. Well, we chose, I came down initially, actually prior to installation, and went through the training, and then I brought our business office, the billing coordinator. She came down kind of midweek to complete training as well. So we did the training before we had really done much of anything at all. I think that was really, really important to give us a good overview of kind of the lay of the land before we get into specifics. And I think that was really important. Highly encourage people to do that. At least one person in the organization to do that, that can see that high level lay of the land. Once you start the implementation, as you guys know, there's a million and different ways to skin the cat, so to speak, and every office is going to be a little bit different. Every office is going to have its own unique features, either with staff or with the type of practice that they do or their location, and that's where the specifics become very, very important. And then utilizing the knowledge base that e-MDs has across lots of different practices now. One of the unique parts is I'm the IT guy as well, so I was able to sort of see the clinical side, what I needed to have happen there, but also from the hardware, the networking, the application side as well, and design a system for our implementation that really has worked well. Standardization is very, very important, and using as much as possible standardized approaches is critical. At our previous practice had suffered with our practice management system that was very robust, but it used a very antiquated database engine. And that update process through that was terrible. We had tried to implement a SAN, this was a huge organization, and the database wouldn't talk to the SAN. And that was one of my first questions to e-MDs was, what is your database engine? What software do you use behind the scenes of your application? How are you programming your application? What languages are you using to do that? What is your network topology, preferred topology? Those were some of my initial questions, and e-MDs sticking with quite standardized approaches. That was very important to me. The biggest thing I would say is go with the integration. Less interfaces is always better than more, and go with an integrated product. And that by itself will restrict the playing field tremendously. I would also say go with something that's web-enabled, because I think that's going to be allow for a lot more flexibility in technology, and also availability and security for that matter. If at all possible, I would look towards that.